the Southern Health and Social Care Trust, we are very proud of the high quality services that we provide for our mothers and babies. Our experienced and friendly staff are here to support you through your pregnancy, labour and postnatal period to ensure that you get the best possible birth experience. This short film will introduce you to our maternity services throughout the community and our two acute hospital sites, Craigavon Hospital and Daisy-Hill Hospital, to give you an idea of what to expect.
At the Southern Trust, we recognise that pregnancy and birth are exciting and life-changing times for women and their families. All our maternity staff, both in hospital and community, will support you in any choices you make. You can be assured that our team of highly trained professionals are committed to giving mothers and babies the very highest standard of care possible. Each year we have approximately 6,000 births.
We provide care for women at all stages of their pregnancy. Our services include a wide range of hospital and community-based antenatal clinics, as well as providing antenatal education classes for women and their partners.
Women who book maternity care in the Southern Trust will either have their baby in Daisy-Hill Hospital in Newry, or they will come to Craigavon Area Hospital. When you find out you're expecting, you can self-refer either via your GP or via the link below. At your booking appointment, we will carry out a dating scan. You will have your antenatal education programme discussed with you and booked. Your schedule of appointments will also be discussed, and we will also book your 20-week scan, and we will also discuss your birth choices. Then at 16 weeks you will return for an appointment. We will discuss your book and blood results, and we will also give you your green antenatal handheld notes to go home with you. We might also refer you to specialist services such as smoking cessation programmes and a Way to a Healthy Pregnancy programme.
The booking appointment can be a lengthy appointment, so please be mindful of this if you bring your partner along with you. They may wish to bring a magazine or plan to go for a coffee while you wait. Remember, you can discuss any concerns or issues with your midwife. To help you prepare for birth, our experienced antenatal education facilitators run a variety of antenatal education sessions in the Trust. These sessions focus on getting to know your baby, the stages of labour, helping you and your baby through labour and birth, feeding your baby and caring for you and your baby following birth.
So myself and my husband went on the Getting Ready for Baby programme, and this is our little baby May. We really found the programme really useful. It was very handy going to the classes because they were at the same time as all your antenatal appointments. We got to know a lot of the midwives, which I thought was brilliant, because when we actually came into hospital to have May, we had already built up a great rapport with the staff. Didn't we? Yes. Yeah, so I really enjoyed the programme. The content was really good. I thought even the practical elements of changing a nappy, which me and my husband, as this is our first baby, had no experience of. So I would really recommend other first-time parents to take part in the Getting Ready for Baby programme.
When a mommy and baby are discharged from hospital, the community midwife will take over her care. The visits are planned depending on the mommy and baby needs. And once this is finished, then the care is transferred to the health visitor. A woman can choose to have a home birth if she's low risk, and the midwife will support her in that decision and provide antenatal care.
I've had 2 home births and they were both wonderful experiences. I had my husband here at home to support me throughout the whole labour process and afterwards. I had the same midwife for both my home births here, and it was wonderful that I knew her and I felt very comfortable with her. I went into labour both times in the middle of the night. I had the baby, I was in water, and I actually got to lift baby up and onto my chest. So I was the first person to hold and touch my own baby, and I would really recommend home birth for all low-risk women.
We have 2 midwifery-led units, one in Craigavon Hospital and one in Daisy-Hill Hospital. The midwifery-led units provide care for women who are able to choose a more relaxed and natural environment for their birthing experience. The units are self-contained with a number of large ensuite birthing rooms, and some of the rooms have a built-in birthing pool.
I'm Colleen and this is Georgia. She's 5 months old. She was born on the midwifery led unit. Initially I used the birthing ball and walked through my contractions, and when things progressed I got into the water and used gas and air. The staff were all really encouraging and supportive. I also like to thank the breastfeeding support staff who helped me to initiate breastfeeding.
We also offer a choice of alternative therapies for those women interested in a holistic approach. This can be discussed with your midwife.
I delivered my third child here in the midwifery-led unit. It was an extremely positive experience.
This is one of our delivery suite rooms. Within both Craigavon and Daisy Hill, we have a number of delivery suite rooms. There will be doctors here 24 hours a day, a consultant here for 12 hours of the day, and they're also on call throughout the night. There's also a birthing pool, so if you decide and if you're able to, you will be given that opportunity. There's also 2 obstetric theatres, so if you do require a caesarean section, it means that they are available 24 hours a day, and also our recovery suite.
If you're for a planned elective caesarean section, this is the theatre environment where your baby will be delivered. If circumstances arise during your labour that require emergency caesarean section, you will come to the same theatre environment. There's lots of unfamiliar equipment and 8 to 10 personnel who will effect safe and timely delivery of your baby.
Elsie was born at 35 weeks. Elsie was very distressed and her heart rate was dropping, and it was the safest option really at that point to go for a section. I had had 2 normal deliveries beforehand. They had told me previously not to be alarmed if she didn't cry, but we got a big cry and Elsie was perfect.
And this is Isaac. Isaac is 10 weeks old, and I said that I would need a section, explained everything about it to both myself and my husband. So I went in the theatre, and within 15-20 minutes Isaac was out. Soon after that I got sent out into the recovery unit where I had my first feed with Isaac, and from then on everything's been 100%.
We offer VBAC as an option for delivery. Mummies will be monitored more closely to ensure safe delivery of baby. There are many benefits to mummy and baby, including a safe delivery for baby and also quicker recovery time for mummy.
My first son was born here 4 years ago, and he was a breech baby the whole way through my pregnancy, so he had to be delivered by C-section, which was the safest mode of delivery for him at the time. But Logan luckily was head down and was able to achieve a VBAC with 3 very, very determined midwives on my side and a little boy that was ready to come into the world.
When you're in labour, you will contact the hospital that you have chosen to have your baby in on the numbers below. If you're coming to Craigavon Area Hospital, you might come via the Maternity Admissions and Assessment Unit to be assessed, and please bring your green notes. If you're going to Daisy Hill Hospital, please follow the directions.
So in the Southern Trust we have 2 neonatal units. One is an intensive care unit for very sick babies required to go, and the other is a special care baby unit. The reasons why babies are required to go to neonatal units is usually for prematurity, babies born under 34 weeks. Some babies might have breathing difficulties and other babies may have an infection. And we're very much aware of how distressing it is for parents to be separated from their babies. So we do encourage the parents to visit as much as possible and to stay as long as possible. And we'd also encourage them to attend for ward rounds where they can meet the nurses and the doctors and discuss the course of their baby.
Rooming in keeps our babies with our mummies and promotes close and loving relationships. It's very beneficial when it comes to breastfeeding and helps you to get to know your baby and baby's feeding cues. Before you go home, one of our healthcare assistants can show you a bathing demonstration. As part of newborn screening, your baby will have a hearing test prior to discharge. You will get the results of this straight away.
We are all here to support you however you choose to feed your baby, and all the evidence informs us that breastfeeding is the healthiest choice for you and your baby. Infant feeding will be discussed throughout your pregnancy, and we will provide you with this booklet which we would encourage you to bring into hospital with you. At delivery, we encourage all mums to have skin-to-skin contact, as this keeps your baby warm, regulates his heart rate and breathing. It's best to keep your baby close
and we will give you information on safe sleeping. We would ask that your family and friends respect the visiting times, and this is important to allow mums and babies to recover and get to know each other.
Sometimes it can be difficult for pregnant mums to talk about their mental health. They worry about stigma or if we'll think that they can't look after their babies properly. But that's not how we see it. Mental health problems are common and important, and we're here to support every mother to ensure the best outcome for the mum and the baby during and after pregnancy. Sadly, some mums will lose their baby, but we have an excellent team of staff in hospital and community to support them through their loss. We're also very grateful and indebted to SANS and other voluntary organisations for their help and support for families in sad times.
We hope this video has given you a flavour of the maternity services in the Southern Health and Social Care Trust. Thank you for spending the time watching this video. And finally, thank you for all the patients, relatives and staff who appear in this video.